My name is Robert Bash, and I am the CEO of Nephera. I'm going to talk to you about the kidneys, because at Nephera, we can prevent kidney injury in hospitalized patients. What do the kidneys do? The kidney's job is to balance fluids in the body, to help regulate blood pressure, and to remove waste and excess water. But in order for the kidneys to do their job properly, they must receive adequate blood supply from the heart. Unfortunately, patients that suffer from heart failure cannot pump enough blood to meet the body's demands, which means that the kidneys cannot do their job. And when there's reduced blood supply from the heart to the kidneys, that leads to kidney injury, which results in worse patient outcomes and much higher costs of hospitalized care. Kidney injury in heart failure patients is a major concern to hospitals. They are losing money treating these patients, and it's a very large market. Heart failure is the #1 reason for hospital admissions in patients over 65 years of age. In the United States, each year, 1 million people are hospitalized with heart failure, and half of them are readmitted to the hospital within 6 months. Most all of these patients are at risk for worsening kidney function and injury. What is our solution? Nephera offers a disruptive approach to preventing kidney injury in hospitalized heart failure patients. We provide electrical stimulation to the nerves in the bladder area of the urinary tract. This triggers a reflex that controls the nerves in the kidneys. And by blocking certain nerve activity in the kidneys, we can prevent the injury and improve blood flow, improve function in these very ill patients. Our device is a catheter. Like other standard catheters, it's a plastic tube with a balloon, but ours has electrical contact points. The catheter, which is in the body, in the urinary tract, is connected to a miniature stimulator device that is outside the body. That stimulator device sends electrical signals to the catheter, which triggers the reflex controlling the nerves in the kidneys. And most importantly, our device, our catheter, looks and handles just like a familiar Foley urinary catheter that is used in every single hospital, every single day among many, many, many patients. So there's no costly training or specialists that need to be involved to use our therapy. We've successfully completed preclinical studies and pilot clinical studies. The clinical work has focused on showing that the device is safe and that when we turn on our electrical stimulation, there's no pain and it's well tolerated among patients. We recently completed an advanced animal study in partnership with a global medical device company. So what does the data show? It shows that when we turn on our electrical stimulation, there is an increase in blood flow in the kidneys, and there's an improved excretory function of the kidneys with less kidney injury. This supports our claim that Nephera protects the kidneys against kidney injury. The data has been reviewed and analyzed by members of our scientific advisory board, which includes leading nephrologists and cardiologists. So what's our value proposition? Why is Nephera of interest to the large medical device companies that sell advanced products into hospitals? We have a cutting-edge nerve modulation technology deployed on a familiar low-invasive catheter device. That catheter device protects the kidneys against injury in hospitalized patients, which is a very large market, an unmet need, and addresses economic pain that the hospitals face today in treating these patients. Thank you very much.
Heart failure patient being treated today in hospital?
Okay. So today, heart failure patients typically come into the hospital in the middle of the night because they're suffering the symptoms of congestive overload, and the therapy is essentially diuretic drug therapy to get the fluids off the body, to get them decongested and home sooner. Unfortunately, many patients develop resistance to the diuretic drug therapy, and they leave still overloaded with fluids, and so they have a very high readmission rate. As I mentioned, half are readmitted to the hospital within 6 months. That's the standard treatment. We are now offering as I said, a familiar device platform to get these patients healthier and well taken care of and out of the hospital sooner.